Good evening, everyone. And it's 6 p.m. It's our weekly meeting. I hope you are not bored out of us hour right now. And I'll go directly to the presentation. Mm. Yes. Is my screen clear? So hello everyone again. And I hope you didn't aren't getting bored because of our weekly meeting, but we are going fast. It's a many module, and we have gone very quickly through endometrial cancer. Mostly, we're going back to some specific topics in endometrial cancer later on, but we are moving fast to the cervical cancer module. And in cervical cancer module, we can't go without starting by prevention and then screening and then going to the course of cervical cancer itself, surgery and treatment and management like that. So, how I get to be an onco-surgeon speaking about HPV vaccination, usually this is a matter covered by pediatric, by gynecologists, by anyone other than onco-surgeons, but really working as onco-surgeon who has been dedicated to gyne-onc surgery for years. In Egypt, I have met like every week I was meeting at least 2 to 3 cases of advanced cervical cancer. And whenever I was traveling around the region and meeting people from here and there and from Africa, from Middle East, from the Arab world, they all agree that most of cases that we meet of cervical cancer are advanced and are non-operable. That's why we don't have high volume hospitals for surgeries of cervical cancer. We don't have surgeons or gynecologists who are trained for radical hysterectomy because a very, very small percentage of cervical cancer patients are presented in early stage. So I used to see every week cases from all age group, 20s, 30s, so many in 30s, 40s, 60s, and 70s in stage 3 to 4 cervical cancer with all those fungating masses, with all those bleeding, with pelvic pain, with, of course, is the very famous hydroureteral nephrosis and renal failures and even fistulas and everything. So I was very astonished why a preventable cancer is so prevalent in advanced stage. And I tried to ask all my colleagues, there is a vaccine. I want to vaccinate. I have 2 daughters. I'm a father of 2 daughters. And then I want to prevent my daughters from having this preventable cancer, one of the very few preventable cancers. And I asked them, where can I get the vaccine? And the big surprise and astonishment for me that most of the healthcare providers don't know anything about the HPV vaccine. So I started to search for the vaccine in Egypt till I found the vaccine. That was a difficult story like 8 or 9 years ago. And then I started to tell people this is a vaccine you can find in blah, blah, blah. And then people, even the healthcare providers were asking, what is this vaccine? So in very few years, I was one of the very few in Egypt who were speaking a lots and lots and really we changed the mindset of Egyptian, and Egypt is a country of 100 million population about the vaccinations, the importance. People started asking about that. So to go directly to the story, in comprehensive cancer control, we have 3 pillars. The primary pillar is primary prevention to prevent the cancer from the start. Secondary prevention is the early detection. And then all what we do, like doing surgeries, chemo, radiation, everything, this lies under the pillar of the tertiary prevention, which is diagnosis and treatment of invasive cervical cancer. In cervical cancer, the story is really unique because it's one, again, of the very few cancers that you can go on the 3 pillars. You can prevent from the start. So there is a vaccine against HPV, and then going to secondary prevention like breast cancer, like other cancers that you can screen and treat precancerous lesion, and then going to the tertiary prevention that all type of invasive cancers do that. So what's human papillomavirus? Human papillomavirus really is not a virus. They are a group of viruses that are extremely common worldwide. There are more than 100 types of HPV, of which at least 14 are cancer causing, which we call high risk types. So when you do a pap smear, you find like this, there is no HPV, there is high risk, there is low risk, or the other things that we're going to discuss mostly with Dr. Mahmoud Sami next week. And HPV is mainly transmitted through sexual contact. And most people are infected shortly after the onset of sexual activity, and that's what gives a stigma about HPV. HPV is through sexual contact. So if you got HPV, you are a player or you are a prostitute or something like that. And this gives stigma, and people for long didn't want to speak about cervical cancer. And cervical cancer is caused by sexually acquired infection with certain types of human papillomavirus. Remember at least 16 and 18. Okay, they cause 70% of cervical cancers and precancerous cervical lesions, the genital warts and not the genital warts. Genital warts are by low risk types. And there is always evidence linking HPV not only for cervical cancer, but for anal carcinoma, vulvar carcinoma, vaginal carcinoma, penile carcinoma, and oropharynx. There is lots and lots of HPV associated oropharyngeal cancers related to the increased practice of oral sex and other practices. Okay. So cervical cancer is common. It's the fourth most common cancer uh, among the women globally, with estimated 570,000 new cases in 2018. Nearly 90% of this worldwide occurred in low and middle income countries. So to make long story short, there are more than 100 types of HPV. At least 14 of them are high risk cancer concerning. Two types, which are 16 and 18, they cause 70% of cervical cancer and precancerous cervical lesion, which are the L cell, H cell, and more than 90% of HPV infections in the cervix are naturally cleared. Remember this word because we want you to be aware, but we don't want you to be super anxious because more than 90% of HPV infection in cervix. So once a lady or a woman get HPV infections, this doesn't mean that I have HPV, so I'm going to have cancer because simply 90% will be naturally cleared by the natural immune mechanism and all the normal vaginal and cervical flora. Again, it causes other cancers, not only cervical, but anal, vulvar, vaginal, penile, oropharyngeal. That's why HPV vaccination should be given to males and females, not only females. Again, HPV is almost responsible for 99% of all cervical cancer. Most cervical cancers are related to HPV infection. 90% of anogenital warts, which is a very, very common problem that I saw in Egypt and in Bahrain, are caused by HPV type 6 and 11. So now we have 6, 11, okay, and we have before 16 and 18. Remember those. And more than 90% of cases of anal cancer are caused by HPV infection. And again, remember the oropharyngeal cancer, which is much dramatically increasing in 9 years from 2000 to 2009 by 30% due to the increased practice of oral sex. So those are the numbers. Oropharyngeal cancer, 92,887. Anal cancers, 48,000. And genital warts are more than 32 million population all over Earth. This is a huge number. And I know all the dermatologists, all the gynecologists, and even now the pediatric see lots and lots of genital warts. With benign cancers in males, cervical cancer in females, cervical dysplasia, all the L cell, H cell, which we called before CIN 1, 2, 3. Now we don't say this, and vulvar and vaginal cancer. So, is it a common virus? Yes, it's a very common virus and can cause cancer. And it's one of the major causes of infection related cancer in both men and women. Okay, so the prevalence worldwide is estimated to be 11.7% in women. So out of every 100 women, we have 11 or 12 women with HPV, which is a very high percentage, and 21% in men. And in men, we can't usually detect HPV virus. It's hidden. You can't detect it, but this is the WHO estimate of how prevalent this disease is. So nearly all sexual active people are infected with HPV virus after becoming sexually active. By age of 50, at least 4 out of every 5 women will have been infected with HPV at one point in their lives, which will be naturally cleared by the natural immunity. And most people who become infected with HPV don't know that they have HPV, males, except after having warts or something like that, and females after doing pap smears or again having warts or some sort of cervical dysplasia. And nearly all sexual active people are infected with HPV within months to few years of becoming sexually active. So this is the global incidence again, and HPV vaccination could prevent more than 90% of cancers caused by HPV from ever developing. So we have cancers. It's one of the very few cancers that's preventable. You can prevent the cancer because we know the cause. In most other cancers, we don't have causes. We have risk factors. So we know risk factors for like breast cancer is familial, genetic. For GIT cancers is like spicy, eating some foods. Smoking is a risk factor. Obesity is a risk factor. But a certain causation, a certain causing factor, this is very seldom in cancers. Like hepatitis B virus cause HCC. So if you prevent HPV, HB, not P, hepatitis B virus, so you can prevent lots of hepatocellular carcinoma. Schistosoma or bilharziasis cause urinary bladder cancer. So if you prevent schistosoma, like what happened in Egypt, you can prevent urinary bladder cancer. And human papillomavirus, which is HPV, if you give protection against it, so mostly you will prevent cervical cancer. Again, it's one of the commonest female cancers. So the problem is from non-awareness that many people didn't or haven't been aware due to the stigma of speaking about HPV and cervical cancer to becoming over panic. So all women are very panicked about that. We want to how to do examination for our partners. Oh, I have been infected. I have some genital warts. I'm going to have cancer. Don't be over panic again because as we said, 90% of it will be cleared of CIN1, which we called LSL. Okay, low-grade squamous intraepithelial neoplasia of cervical cancer are going to be cleared. So if you have HPV infection in pap smear, this is something that means just follow up. Don't be over panic. Mostly it will be cured. It will be cleared. I don't cleared. And even if it causes changes and some sort of CIN1, mostly it will be cleared. So you don't have to be panicked. Your doctor shouldn't panic you, and your doctor shouldn't be panicked. So I see many girls coming in 30s and having pap smear showing or biopsy showing CIN1, and they want to have a hysterectomy or radical hysterectomy, or their doctor want to do a hysterectomy. No, why? This is really nonsense to do a hysterectomy for CIN1, which 99% will be cleared next year, and you will not find that, and you don't do it. How it is transmitted? How is HPV transmitted? The most common route of HPV transmission is sexual contact. However, there are many increasing data and evidence that HPV virus is stable and can survive on a lot of chemical treatment and still can be transmitted with non-sexual routes. So the risk factors are younger age at first vaginal sexual contact, younger age at first oral sexual contact, higher number of sexual partners, but tobacco smoking, lower level of education, lack of insurance, and black races. But there are some non-sexual routes of infection, like what we is being really having some evidence about those doing the laser and the bikini areas and in the cosmetology and all those plastic and derma centers, like having an ultrasound probe that is not totally sterilized, like in the pools, in the toilets. So there are some evidence, not very clear, about non-sexual transmission. So it is not only the sexual route for having HPV infection. And the questions that are usually asked for me is that we are conservative religious countries, okay? And I usually answer that we have sexual routes, which are vaginal sex, anal sex, oral sex, close skin to skin touching. However, again, we have non-sexual routes like transvaginal ultrasound, probes, colposcopes, the underwear, hand-to-hand contact. And again, we may be religious, but in our religion, the man can be married to four. This is really something that happened. So it is from your religious, conservative point of view, a man can have more than one wife, and then he can transmit HPV from one wife to another or from one partner to another. If we do claim that the only route of sexual contact in our countries is marriage, so marriage, we have multiple partners rather than the Western countries. But of course, this is we all know this is not a true thing. We have lots of sex outside marriages. And then I'm being accused. So you are encouraging liberty in sexual practice? No, I'm not encouraging liberty. But for example, you can marry a man. You can be who has been married before. You may be the best and the most conservative woman in the world, but your husband is not, or your partner is not. Your partner maybe have maybe a widow, maybe have before married. So this is something that doesn't depend on how you have raised your daughters, on how. So if I'm vaccinating my daughters, I have brought up my daughters. I am proud of my daughters, but really I can't guarantee their future partners. Okay? So this is something that I have to protect them, and I have to protect them uh, in all their decisions, in everything. So my role, like a father, is to protect my daughters, whatever the situation is. But I'm not encouraging the sexual liberty, really. So this is something that I can clearly reply if someone saying that for me. So this is the structure of human papilloma virus. It's a non-enveloped virus. We don't have an envelope. And the HPV exists as genetic material, DNA, surrounding by a capsid, not an envelope. It's a protein-infused capsid. This capsid acts to surround and protect the HPV genetic material inside, and it helps to bind this particular cell to the virus that it needs to infect. So we have a cover, not an envelope, just a cover with the active material inside. Okay? So this is the infectious HPV. What we do in the vaccine is we give this capsid, this cover from outside without the infectious material. So when the body sees this capsid without the infectious material, the body will think that the body is being infected by HPV, and so the normal clearing and the normal immune mechanism will work to clear out this infection without true infection that comes, and this gives long solid immunity against it. So again, the HPV vaccine is just the cover without the infectious DNA material. There is no viral DNA inside, and so just we deceive the immune mechanism of the body. The body, when he sees the cover, oh, this is the virus, I'm going to enhance my immune mechanism and clear it away, but really without being infected. So this is how we give the vaccine, which doesn't contain the oncogenic DNA inside. This is very simple, I think, to understand. What is the vaccination schedule? We start at the age of 9 to 14. We give before 15 or before 14 years old, we give two doses in 6 months apart. So give 0, 6, 0, 4, 0, 3, two doses within 6 months. After 15, we give three doses within 6 months. So we give 0, 2, 6. We give in January, then in March, then after 4 months after March, so it's in July, for example. So this is the schedule that's mostly worldwide accepted. Before 15, you give two doses. After 15, we give three doses. Why after 15 we give three doses? Because the earlier you give the vaccination, the longer the solid immunity that you give. So the better to give before 15 years old for our daughters, for our sisters from 9 to 14 years old. But after 15, the effect will decrease. And as you go older and older and older, the effect is decreased. It is not diminished. So it is given till 26 years old. It is given before marriage. So if I am older than 26, yes, you can have the vaccine. If I am married already, yes, you can have the vaccine. If I am 50 years old, yes, I can have the vaccine. But still, with much less efficacy and less evidence of efficacy, rather than giving it the solid long immunity by giving it before 15 years old or early before 26 years old. Okay? But again, for some limited resources, the WHO has done the recommendation that we can give one dose before 15 and two doses after 15. Okay? Within 6 months apart. So the regular dosing again, before 15, two doses, after 15, three doses within 6 months. Before 15, 0, 6, after 15, 0 to 6. But again, for limited resources, in some situations, you can give only one dose before 15 and two doses 6 months apart within 15 to 20. But after 20, it is much preferable to give two doses at least. In UK, the number of doses depend on the age and how will the immune system work. So people under 25 have one dose. Sorry for that. People aged 25 to 45 usually have two doses. People with weakened immune system usually have three doses. And again, if we have some immunocompromised boy or girl, we must increase the doses to be three doses. Okay? So another frequently asked question, does HPV, human papilloma virus, cause cancer immediately? So we should know the natural history of high risk. Again, we are not speaking about the low risk, which cause the genital warts. We're speaking about the high risk, which cause cervical cancer. So HPV infection within 1 to 2 years will cause a transient infection by HPV, and more than 2 years is called persistent infection by HPV. This persistent infection will go to low-grade dysplasia and high-grade dysplasia. It may go directly to high-grade, or it may go to low-grade dysplasia. Low-grade, what we call L cell, and high-grade, which we call H cell, okay? And then after 2 to 15 years, it will call invasive cancer. So if I have HPV, for example, infections this year, I will not going to have cancer next year. But it's 2 to 15 years after, up to 15 years after being infected. But mostly within 1 to 2 years, it's transient infections that would be cleared again by immune mechanism. And again, as you see, all the arrows are reversible. So low-grade dysplasia can change back to be cleared, and high-grade dysplasia can be cleared. All can be cleared. The only thing that can be cleared, the only one-way arrow, is the arrow from high-grade dysplasia to invasive cancer. This is the only one way that goes to invasive cancer. Once we have invasive cancer, it will not be cleared by the immunity. Okay? So again, the risk factors are infection with high-risk HPV types, 16 and 18 mainly, immunocompromised status, that's why they should be vaccinated, they must be vaccinated, co-infection with other STDs, and tobacco smoking. Okay? Mhm. Again, as we have discussed, is that early protection works best. Okay? Well, I'm not going to speak about the screening now. The screening will be Dr. Mahmoud Sami's, inshallah, part next week, I hope. But early protection, as we give early before 10 to 15 years old, it will give long, solid immunity against infection. Okay? The cervical screening test can detect HPV even before cell changes occur. So it can detect just the infection without L cell, without H cell, without CIN1, without CIN2. It can detect just the presence of virus and which types of virus, which are phenotypes of virus are the high risk, low risk, one type or several types or what. Okay? Another question that I'm being asked, HPV vaccination is something new, like the COVID, for example, and with all the problems of COVID. No, really, the HPV virus has been discovered since 2003. It was the first bivalent HPV DNA testing was licensed in 2003. So it's more than 22 years right now. And in 2006, it was a quadrivalent vaccine, okay, that was done. So it's more than 20 years right now. And 2008, Harald Zurhausen wins the Nobel Prize for his detection of the etiological role of HPV to cause cervical cancer. He passed away just last year, I think, this great scientist. And when he knows that HPV is a causative, the vaccine was done under that. And so we have now the 9-valent. Okay, so it's not a new vaccine. It's something that has been for more than 2 decades, has been tested and has been proven to be efficient. Some people come and say HPV vaccination is still debatable. For example, they say it's banned in Japan, but really this banning in Japan happened like more than 15 years ago. The banning stopped. Now it returns to whole vaccination program in Japan. And even the IGCS past president, he's not the president now, he was invited as guest speaker in IGCS 2024 in Dublin, Ireland. We were there, and they were speaking about HPV vaccination in Japan, overcoming the challenges and setbacks, and it is now back in the screening program. So the old myth that it is banned in Japan and Japan are very good and something like that, no, it is now in the screening, in the vaccination schedule in the Japanese, for the Japanese people. Okay? Will it really provide immunity against infection? Yes, it provides immunity against infection, and this was, I think, published in the New England Journal of Medicine. It provides 98% efficacy against HPV 16 and 18 related CIN2, 3, and cervical cancer as well, and 100 efficacy against HPV 16, 18 related vaginal intraepithelial neoplasia or vulvar intraepithelial neoplasia and vulvar or vaginal intraepithelial neoplasia and vulvar and vaginal cancer. And the efficacy in anal cancer is much less. And for the genital warts, it gives 89% efficacy in males and 99% efficacy in females. And these genital warts really, really are annoying, even for cosmetic reasons and psychological reasons for the females and for the familiar relationships and for the partnerships. So again, this has been proven to be really effective in that. Okay. With a long nationwide study done in Sweden about the quadrivalent vaccine, it really has proven that HPV is associated with substantially reduced risk of invasive cervical cancer. This is something that's not debatable in science anymore, that HPV vaccination will decrease invasive cervical cancer, as you see in these graphs. So what are the available HPV vaccines? We have the bivalent vaccine against 16 and 18. And then we have the quadrivalent vaccine that's present in Egypt against 16, 18, 6, and 11. And you are lucky enough in Bahrain that you have the 9-valent vaccine, which is 16, 18, 6, 11, 31, 33, 45, 52, and 58. What are those reds? Those are the high-risk genotypes that cause cancers and dysplasias. What are the 6 and 18? They are the low risk that cause congenital warts. So having the quadrivalent vaccine or the tetra or the 9-valent vaccine will really prevent all the hassles of anogenital warts by 99% or 98% and will prevent cancer eventually. Okay, is it safe? Yes, it's safe from the WHO. The most common side effects are just those related to the injection itself, swelling or pain, headache, dizziness, feeling sick, or the fear from the injection, but it doesn't have any serious side effects. It hasn't done something like that. So the WHO Director General call from 2018 said that no woman should die from a deadly disease. It's deadly, but it is preventable and curable. Okay, so when we have something that's preventable, really it should tend to be history, like many diseases in medicine that turned history, like plague, for example, or something like that. The vision of 2030 that in 90% by 2030 worldwide, this is a vision of ESGO, IGCS, WHO, all the World Health Organizations. 90% of girls fully vaccinated with HPV vaccination by 15 years old. So 90% should have been vaccinated by 2030, but now they are saying that when we are approaching 2030, this really may be not achievable. Maybe we'll have to wait another 10 years or something like that. 70% of women screened with a high precision test at 35 and 45 years of age, and 90% of women identified with cervical disease receive treatment and care. So this is 2020-2030 is a decade of eliminating cervical cancer, where FIGO, ESGO, IGCS, WHO, all the members are embedded on the front line of global health, together are committed to solve this preventable tragedy of cervical cancer by 2030. Our global reach can help to facilitate the delivery of national projects integrated within border sexual activities. And I'm not terminating, I still have two slides that the WHO Director General said, through cost-effective, evidence-based intervention, including human papillomavirus vaccination of girls, which was our topic today, screening and treatment of precancerous lesion, which will be the topic of Dr. Mahmoud Sami, and improving access to diagnosis and treatment of invasive cancer, we can eliminate cervical cancer as a public health problem and make it disease of past, which is our old dreams. What are those slides? This is something because when I came, I asked one of my Saudi board fellows, and she said for me that there is no HPV in Bahrain. But really, those are 6 cases of hysterectomy, radical hysterectomy that I have operated. I started operating here in August, so it's August, September, October, and November. In 4 months, I have operated 6 cases of cervical cancer. I don't know if the slides are clear, but you can see for the first one, it was adenocarcinoma HPV associated. For the second one, it was again HPV, squamous cell carcinoma HPV associated. For the third one, it was adenocarcinoma HPV associated. For the fourth one, it was neuroendocrine, mixed neuroendocrine carcinoma and HPV associated adenocarcinoma. For the fifth one, it was high-grade squamous intraepithelial neoplasia, CIN3 with HPV, and then invasive carcinoma happened on top. And for the sixth one, it was squamous cell carcinoma HPV associated, moderately differentiated. So we have like 3 squamous cell carcinoma, 3 adenocarcinoma. The 6 cases that I operated in 4 months, radical hysterectomies, were HPV associated. None was non-HPV associated because some people said that cancers in our region are not HPV associated. So in Bahrain, it's a problem because in Egypt, I did the case for radical hysterectomy like every 2 months, for example, or every 3 months. But now in 4 months, I have done 6 cases. Those are my work. So we have many other cases that were presented in advanced stage 3 and 4 and sent directly to chemoradiotherapy. So we are seeing lots of cases in a very small country about HPV. So you should really take this seriously because as I see in the Ministry of Health, you were lucky enough that you had the human papillomavirus incorporated in the school vaccinations for the age at 12 to 13. So really, this is good from the Ministry of Health in Bahrain. And in the vaccination booklet in Bahrain, there is a paper about human papillomavirus. This is inactivated virus, as we said. You have the bivalent, quadrivalent, and nonavalent. And you have the nonavalent here, starting at 9 years old. Dose 0.5 millimeter deltoid muscle intramuscular. Two doses for 9 to 14, and three doses 15 and above, as we said, or two doses schedule or three doses schedule. And this is the precautions, contraindications. So you have everything. So I believe that all Bahrainian should be vaccinated against that. And thank you. And I'm now ready for your comments and questions. Dr. Mahmoud Sami, just give me a moment. دكتور محمود اتفضل. Just unmute yourself, please.
Okay, مساء الخير يا باسل.
الفل يا باشا.
Thank you very much for your presentation. Well done, always. Regarding the last point, this is the incidence or the prevalence of HPV vaccines in our regions in Bahrain. It is low. No, it is very high. Yeah, I cannot compare it, of course, with Egypt because this is Egypt. We don't have statisticals or something like that. But I think this is the point why we have a high incidence, because we have a high rate of screening, especially with pap smears. And
Yes.
also we have the facilities for the genotypes of HPV. We are capable to differentiate between low risk and high risk and which type actually.
Yes.
It's, one point. Second point is, what do you think about the vaccination for ladies who already positive for HPV?
يعني this has been answered, Dr. Mahmoud, already by يعني by signs that still yes, after being infected and with clearance or after having everything, you can give the vaccine, because at least you know there are several phenotypes. So for example, if she has got the low risk with genital wart like 6 or 11, we will protect her against 16 and 18, which are the high risk and will cause cancer. And again, you have like more than one يعني other species and phenotypes of cervical cancer, so you can prevent that, and even they will decrease the back again. So from evidence-based point of view, yes, now it's recommended by the WHO recommendation, even those who has been infected before. So those who has been infected before, yes, they will benefit from the vaccination, and those who are older than 26 years old will benefit from vaccination. Those who are older than 50 will benefit from vaccination. But of course, the best benefit will be for the young girls and boys who will be vaccinated at 9 to 15 years old.
Yeah, I do agree
Again,
with you. Yeah. The second thing is that there is many studies which encouraging to give HPV vaccines, human papillomavirus vaccines, for the ladies who went for conizations or local therapy of the cervix, if you also are carrying CIN3 or something like this. Do you
yes.
agree?
Of course, any woman with a cervix, she should be vaccinated, whatever have happened in this cervix.
No, after the procedures.
Yes, even after the colonization,
Ah,
but as
ah.
long as she still, يعني, even after the procedure, and even when I came, Dr. Mahmoud, I saw that were doing pap smears for all cases, even having hysterectomy. I said we will continue doing pap smears for cases who has done hysterectomy for a cervical lesion, not for ovarian or for endometrial.
Okay, last point. I think that is things. Hello.
مع حضرتك اتفضل.
Ah, uh, the issues of male vaccinations has not been sorted out, because they said that is, I think that's when we finished, we will be capable to finish all vaccination of the school girls. That is, and there is extra, we will go for the boys here.
Yes, because Dr. Mahmoud, simply boys usually are the cause, you know, males are the cause, and males are أنانيين, يعني males are more or less selfish. So you will never detect. You don't have a pap smear for males. You'll never detect it, but they will transmit the infection from one woman to another like that. and it will not cause cancers in male rather than oropharyngeal, penile, and anal, which will be much, much less than cervical and vaginal and vulval carcinoma. So we give males usually this vaccine to protect the females. So what my message for the females usually, protect yourself, encourage your partner to be vaccinated, but if he is not convinced, protect yourself at least, okay? But it is more manifest in women, of course, and it cause more يعني disastrous effect for women. But males, after having the genital warts once, they usually come to be vaccinated. Once they have genital warts, they become very, very anxious because they will be exposed even to their females, and then they come to be vaccinated after having the penile warts. And we are
You are right. And by the way, who's Mahmoud? Who's Mahmoud?
no, no,
You
Dr.
used to
Sami,
call me Sammy.
Dr. Sami. You write you yourself writing M Sami in the in the Zoom. It's same.
Okay,
So دكتور
thank
سامي
you.
يعني we will ask your pardon to start next week at 6. انا عارف ان حضرتك ملتزم بصلاه العشاء في ميعادها بالظبط, but يعني many of our
لا
attendees to be at 6.
آه،
فيعني we are waiting for a very nice presentation about screening, about the
إن شاء
preventive
الله.
disease, how we do this.
About the pre-invasive
Yes,
cervical cancer.
because really, really, Dr. Sami يعني like is an expert in that part with all his knowledge and his corpuscopic
Thank you very
finding.
much.
Really, really, I like your work in the Dr. Sami. فيعني we are
Yeah,
waiting. We are waiting
don't say
to.
that because the people will believe it. Don't
No, no,
believe
they
it.
know, all Bahraini know that you are the best in this.
Thank you very much.
Dr. Tarikan, just unmute.
So,
Mm.
hi, thank you. You can hear me?
Yes, Dr. Tarikan, we can hear.
Yes, thank you. It was a great presentation as usual. Uh, besides cervical cancer, it has also protection in oral, as you know, in the oral cancer also for
Yes.
males. It is also protecting also the benign lesions and the other things.
Yes.
As Dr. Sami mentioned, males are, and you mentioned, males are the main factors.
Yes.
Yeah, we have to encourage everyone. I have one boy, one girl, and I vaccinate them both.
Yes. I have
What
two girls
about,
and I vaccinated.
yeah,
I think my girls were the
yeah,
first in Egypt to be vaccinated.
yeah. What about the males? Because now we are talking about always women's, after age also. When is the same, but can we use that also for the same in the males? If they are above 30, above 40, above 50, what
They
the
should,
literature is saying in that point
the literature
for
is
the
saying
males?
males, boys, and girls, okay? But again, if you in 9 to 10 years old or before 15 years old, usually this is a decision of parents. So if you are going to say for a woman, for example, vaccinate your boy to protect her future partner, his future partner, she will say no. Okay. But it's something different when you say protect your daughter from future infection. But it is encouraged for both males and females. But for, as Dr. Sami said, for health economic reasons, if there is prioritization, the prioritization will always be for women, which with the more genital warts and the more cervical cancer, blah blah blah. But if you have the resources, of course, vaccinate male and female, and we encourage male and female to be vaccinated all over the age groups, not only before 15 years old.
Thank you.
Thank you. Dr. Ala Ismail.
السلام عليكم.
عليكم السلام.
شكرا. Thank you very much, Professor Basel, as usual. Excellent. I have a comment and I have question, if you please. Comment, Egypt still now, as you know, there is a preventive initiative about screening of cancer cervix. And in Asyut, we did many awareness campaign for the students and faculties in Asyut University and Israel too, and Ministry of Health. But still, till now, we have a challenge for accepting the screening. Some people's or some women's, when you said we will screen against cancer cervix, they said, as you know, there is a still background about that cancer cervix is sexually transmitted. HPV is a sexually transmitted. So she said to us, I am straight, my husband is good, I will not do it. We have challenged against this. And the second challenge with HPV vaccination. Till now, there is gloomy or background, dark background about, as usual, as you said, about the vaccination, like COVID vaccination. And the main concerns for our localities we faced is that the vaccination of the female will lead to infertility. This is the main concern we have faced. And we tried again and again to clear this unknown or unusual non-background about HPV vaccine, but still we faces many challenges to spread the awareness of screening and HPV vaccination. But we are trying again and again. My question, what could we do to improve or to remove these dark challenges about HPV vaccination and HPV screening in Egypt? Number two, what about we have, I think Professor Sami asked this question, but still we have a female doing a hysterectomy for benign lesion, and they aware may, because HPV vaccine may lead to cancer vagina or cancer vulva, although vaccination or screening is stopped if we have hysterectomy for benign lesion. But if the patient asks me to do screening or to do cytology, although she have a pregnancy, she had hysterectomy for benign lesions. Number two, I think you answer the question. Still, we have a female with CIN2 or 3, we have do LEDs or conization. Do we have a chance to have even one dose of HPV vaccine? Number three, if we have an HPV vaccine, HPV testing and HPV DNA, and the patient proved not to have to have 16 and 18, still have a chance for vaccine or not? As you know, if you have vaccine, I think she has the immunity. Thank you for a long question. Thank you very much, Dr. Bass.
Thank you, Dr. Ale. So I'll try to answer as much as I could concentrate. For the third
Yes.
question, really answered it, that even for those who has been infected by any phenotype, still she would be vaccinated to protect against other phenotypes, and maybe even if she has long immunity against this specific phenotype. Okay, so they have 9-valent vaccine. If you have one phenotype, you will be protected against the other 8 types. Of at least there are 6 high risk and 2 low risk types. Okay. So this is for the third question. For the second question, after doing hysterectomy, no, I don't see there is a place to do screening and vaccination, because vaginal and vulval cancer still are very rare cancers. They are not common as cervical cancer. Cervical cancer is very common worldwide. So we know there are some principles to do screening for any cancer. I'm not going to do screening for melanomas, for neuroendocrine tumors, there are some criteria to do screening for a disease. This disease should be prevalent, should be common, should be early detectable, should be curable, blah blah blah. So vaginal and vulvar cancers, they are from the rare gynecological cancers. Vulvar may be more common, but still rare. Vaginal is very rare. So I'm not going to vaccinate thousands for women for a very rare cancer, or to do screening with all the screening. The screening really is something that is cause some sort of anxiety, false positive results, coming to the hospital, exhausting of the patient and not the patient. She is screened, so of the woman and of the health resources and of the healthcare providers. So to do screening for any disease, we should have this criteria covered, which is not for vaginal. So for myself, when I came to Bahrain, I stopped doing any volt smear for cases that has done hysterectomy. Okay, except for cervical cancer, those who have done hysterectomy for cervical cancer, because I'm searching for the cervical volt recurrence. Okay, but for those doing having endometrial carcinoma or ovarian cancer or any benign disease, I stopped doing the pap smear. I think that Amala and Dina and Sheikh are with me, my team here, and we stopped doing that, not to exhaust the patients and not to exhaust the health resources, because it's all about the health policies. You will not screen 10,000 to detect one. This is not efficient, not cost benefit. So this is my the second question. This is the first one, which is the most important about the myth and about the usual misinterpretation and the questions we have, like what I have seen to have the questions, and now you know the questions, and you should prepare yourself with the answers. For example, that one I said we are when you say you are conservative انا هقول لك ماشي انا مصدقك I believe you are conservative but by our religion you can marry four and so you can have multiple partners and then you can give it from partner to another okay you can have some widow some divorced someone before you don't you are not going to control the whole circle of your partners but of course يعني from the start I'm not with that we are conservative there is no conservative anymore
Yes,
in
yes,
any region okay but
yes,
يعني for those who don't want to hear this even from a religious point of view you can have multiple partners and this can infect the part but you will have forever those who are anti-vaccine and those who believe myths who don't believe science and even they can become the president of USA and still believe what of course not only the law
yes,
economic so
yes,
you have up to the level of president of USA and still he has his own mess and
yes,
so but you have to do your best you and you will not do
yes.
everything.
Yes, I think yeah, and the most important point you said today is about an extramarital. We have an extramarital
Of course, of course,
okay,
of
we
course.
have actually well, although our conserve is this يعني I think this is a very important point يعني I think يعني you declare it today
In
if
all
yes
socio-economic standards, we
I
have
think
it.
this you said to me today we have عبد البرعي he
Yes,
maybe this
الحاج
will
متولي
break yes
الحاج
حاج
متولي.
متولي he will
Mm.
this slide will break the false thoughts about
Yes,
even you have a marry for 5 or 6 female
yes.
even is it within the religious but still have a risk. I think this one will break most of the important breaks
Because
back through. Yes, thank you very
because
much.
الحاج متولي has 4 wives. One of them
Yes,
was bad. You remember the
yeah,
fourth
yeah,
was bad and was coming
yeah,
only for his money and was so even him he has chosen a bad wife, but the three was very good. But he has
yes,
one bad wife.
yes.
Maybe this bad wife who were coming just for money for his money had HPV infection. You know.
Yeah, yeah, yeah. Thank you very much. Thank you.
Thank you, Dr.
Thank
Ale.
you. Shukran. Thank you very much.
Thank you, Dr. Hisham. So Dr. Amir Zidane has a question. Thank you. Can we switch between different vaccines during the course of vaccination? Usually the data, it's better if you started with the quadrivalent and then you have the 9-valent. It's better to start to have it from the start. Okay, we don't have enough evidence to answer this question, but now the recommendations from the vaccination groups is that if you are going to start, you can start the like as if you are starting from the start, but again you can follow the 1 2 so يعني 1 dose before 15 or 2 doses before 15 okay yeah, or 2 doses before 15 but again start forget the previous one you don't start with 4 and then have 9 okay. Wadia Gherbal, if our patient receives the bivalent vaccine, can she take the 9? This is the same question of Amira. Dr. Wadia, if she has the bivalent, it's better to start the 9 Gardasil, but you can يعني de-escalate. So if she is before 15, give her 2 doses, give her 1 dose only. If she is after 15, give her 2 doses. Okay? If you want to be more and more يعني meticulous, give the 2 3 course or the 1 2 course or whatever you like. But start it from the start, the 9-valent. Dr. Hisham, yes. Dr. Hisham, your voice is so away, so far.
Do you hear me now?
يعني with yes.
Okay, I have few questions. The first, when we had a campaign for introducing HPV vaccination in our locality in Upper Egypt, we had many questions about the effect of HPV on fertility and concerns about future pregnancy. I
Yes.
think this also has to be addressed in our lectures, not only about the mode of contacts. We all know that there are some, we are conservative community and they are now changing in the behavior of our communities, but also the effect on fertility and the concerns about the future pregnancy may be the main obstacle against the vaccination.
No, just you answer that there is no evidence at all for that. You have no evidence. Just when someone tell you, give me your evidence for this. Just
I heard your answer about that HPV positive patients can take also the vaccine because there are multiple strains.
Yeah, yeah,
And
yeah.
so this raises a question: does we have any reports about infection by multiple strains, and if there is any effect, if it is more, for example, aggressive or or difficult to treat, or anyone? Because I didn't see any reports about
No,
multiple
no,
strains.
Hisham, simply you will see many cases that will tell you that we have genital warts. We have those genital warts have been gone away either spontaneously or with treatment, with laser, with creams, with whatever they have done, and then they have another infection 2 to 3 years later or 4 years later. I think this is a very common scenario with all gynecologists and dermatologists. Even you ask your colleagues from dermatology, so it is very common to have infection. This infection cleared, and then after 3 to 4 years, you have back infection with genital warts.
Many cancers are now related to HPV, as you said. So,
Mm.
do we have to search for other types of cancers when you have a case which is HPV positive or having cervical cancer, or we don't have to look for that?
يعني how we are going to look for it for a woman, for example, with cervical cancer, you have to examine the vulva and the vagina and everything. You have to examine it, يعني, but you will not have a biopsy, for example. For oropharyngeal cancer, how you are going to detect it, يعني, early detection of cancers have some criteria, like I said to Dr. Alaa, screening and early detection have some criteria. First of all, to be common cancer, and second, to be early detectable and easily detectable. And to detect it, for example, it should be a simple test like pap smear or something like a fecal DNA test, a fecal occult blood in stool. Some simple tests. So, for example, if you do PET CT for everyone, you can detect cancers, but PET CT is not a simple and not a cheap test. I can give يعني, another presentation maybe after we finish about the rules of screening. Which disease? Because people come, we want to screen for HCC, for example. It is not early detectable, and if you detect it, will it differ? And so it should be a widespread disease that's early detectable and easily detectable by a cheap, cost-effective test. And when you detect it, you have a treatment line for it, so it is treatable, for example. And this treatment will change in the overall survivals, and then will increase the life survival and productivity of the individual. Are the criteria that we should do to say this cancer is under the umbrella of screening.
From your
So
experience, have you seen cases with double cancers related to HPV, either
no,
at the same time or sequential later?
you have these multi-centricity. You like have this multi-centricity in the field for vulval cancer, for example. You will have multi-centricity and vaginal, for example, cervical and vaginal. Even for serous ovarian cancer, you have some cervical extension. So I'm not to consider anything that happened in the the woman genitalia to be like two cancers. So if we have vulval and vaginal in the same type, it just may be skip lesions, skip lesions from here and there. But for example, to have oropharyngeal cancer, HPV related, and cervical cancer, I don't remember for my best knowledge. To have, for example, penile cancer and anal cancer, the penile cancer is very rare. So this were extremely speaking about very rare entities. I haven't seen that, yani. If anyone have seen, he or she can say, yani.
If you allow me one last question,
تفضل
because
دكتور.
usually I see cases with warts, genital warts,
مم.
or even with CIN, and
مم.
they are coming for asking for any drug that can clear up the HPV infection. If there is anything that is reported or under investigation that
Yeah,
can
yeah. There
clear
are
up
there
the
are
HPV
many
infection.
drugs that all are reports, as you said. There is no evidence. Micropotomes. There are many drugs, and even in Egypt you have this gel, but all these drugs are not effective 100%. But you have many drugs. يعني
Do
that
you recommend any?
I'll send you the one used in Egypt. You will not find in Egypt except for one. I'll send it to you by WhatsApp right now.
Okay.
Okay, but يعني I do it just like عشان اريح ضميري, but I don't believe يعني. But يعني هبعته لك دلوقتي.
Because HPV, it seems like a social stigma,
Yes.
and many patients are asking for such.
I'll send you the gel. It's called Silogel, SILUAT. I'll send it to you by WhatsApp.
Okay, thank you.
Thank you, Dr. Hisham. Dr. Said was raising his hand. This is Dr. Said Shaban. Is this Dr. Said, our Dr. Said, or whom?
سعيد شعبان مستشفى الجلاء في الباشا.
Dr. Said, أهلا بحضرتك. Do you want to ask anything?
I want to ask about role of global vaccination in Egypt. is not recommended because financially and or any cause, any other cause, yeah.
No, no, no. It's the cause in Egypt. It's يعني purely financial. We were about to put it in the vaccination program, but then we had the COVID, and then we had the Sudan war, and then the Russian-Ukrainian war, and then Palestine war, and so it's a wholly it is wholly يعني financial. If and I usually say we don't have to put it in the national program unless our economy permits that. But at least everyone and every parent should know that there is a vaccine. If you can afford to go and have this vaccine, and then when we have the economy is established, and then we must have our clear data about HPV prevalence in Egypt. So I say you can't put the car in front of the donkey or in front of the horse. Usually give me the data, give me clear, accurate data. How much prevalent is HPV vaccination, it's HPV infection in Egypt? How many cases of cervical cancer in Egypt, and then we can say, like doing the health economics to see, no, we should put it in the vaccination schedule for school girls and school boys or not. But for example, in all the GCC, in all Gulf region, in Qatar, in Emirates, in Bahrain, in Saudi, it's now implemented in the school vaccination because they are either يعني, medium resources or high resources setting. But even in Libya, in Morocco, it has been implemented in the vaccination program. If the economy and if we have good health economic specialists will recommend it according to the prevalence, we should have data. Nothing before having exact data, and we are waiting the presidential initiative to give us in Egypt that. But in Bahrain now it is implemented in the vaccination program.
They give only one dose before 15,
Yes, for
only
Egypt,
one dose or two doses.
for Egypt, I'd recommend the one dose before 15, two doses after 15. I'd recommend this. Dr. Sami is still reading
About
his.
HPV,
Uh, yes,
about
Basil.
Sorry, Dr. Sami. Dr. Said is
No,
still.
let him to come to finish.
Yes. Yes. Dr. Said,
uh,
اتفضل.
uh, uh, excuse me, last question about HPV and pregnancy, HPV vaccine and the pregnancy. If she after get the first dose, she got pregnant.
It is
I continue the doses after delivery or
we have
during
some
the
that
pregnancy.
we have the data, and even from MSD before they told me it's you can give it in pregnancy and lactation, but I don't give. But it's not non-evidence based, but يعني it is safe to be given in lactation at least يعني.
Thank you.
But I myself I don't give it for pregnant lactation. Yeah.
Thank you.
Yeah, Dr. Sami.
Just a comment regarding the issues of Dr. Ala Ismail about the campaign. I don't think that is a campaign or we are trying to increase the awareness or to raise the awareness of the people to come and to do screening. We shouldn't forget that we are in the middle income countries. So our resources is very low. It is not the problem. The other problems we are not doing even pap smear for the patient who are coming to our clinic unless they have a complaint. That is one point. Second point, that is the reading of the cytology.
Yes,
It is
exactly.
very difficult in Egypt. I remember that is in each hospital in Germany where I was, there is a cytology lab in each gynae department. Cytology lab, at least. And here in Bahrain, the lab is in the next door for us. So, okay. And we are doing a plenty of pap smear. We are doing a plenty of colposcopy. يعني the issues is about the resources. And even when you are doing it in Egypt and you are sending it for any lab, the interpretations on the report which comes to you, something different. يعني
Yes.
under standard,
Mhm.
they are not categorizing anything. They are trying to satisfy the gynecologist.
Dr.
There
Sami,
is
this is a
some
problem.
abnormalities.
This is a
I'm
problem.
sorry.
No, no, this
Yeah.
I don't know. Is this a problem of Egypt? It was totally chaos, and that's one of the causes why I moved here. But really, what they are doing now in the presidential initiative, because I was part of this presidential initiative before coming, Dr. Ala and Dr. Hisham are part of it too. They are trying to uniform that they are trying to like train to have specialist pathologists and cytopathologists to read pap smear and to train people how to do pap smear. But the problem is with the mass chaos with the huge number of gynecologists in Egypt is that even don't know how to do pap smear or what is the kit or how to do it or even what is the virus and then sending it to any lab and the lab giving any result. This was totally chaos. It's trying to be now fixed by the precision initiatives. They did great work, but again, to control a country of 110 million population, this is something very, very difficult. But they are on the right track right now. They are doing it. It will take time, but I totally agree with you. That was my main heartbreaking in Egypt. That when you are speaking about do the database first, have the data, do the training, do the basic training. You said, no, no, everything is perfect, everything. And that was a sad story. That's why I'm here very happy with you now, Dr. Sami. Dr. Ala want to say something. Dr. Ala, yes.
Yes. Thank you, Dr. Professor Sami. Thank you, Professor. I'd like to mention the two comment of Professor Sami. He asked, he said that we have two problems. Problem of HIS, we don't have data about the disease in Egypt because, as you know, we have doesn't any recording for anything. The second one, as said Sami, the Professor said, Sami, pathologist. This is the main problem for interpretation. I think in the future we have overcome these two problems. We are waiting for the marvelous presentation of Professor Sami next week, and I recommend Professor Basel and Professor Sami to have one what's called the recommendation guidelines for these two presentations in English and in Arabic to propagate it for a health provider all over the Egypt. I think this is very beneficial to them. Thank you, Professor Bess. Thank you.
But again, I don't want to Egyptianize this series of lectures. This is purely for Bahrain because we have done this in Egypt for several years.
Yes.
So I'd encourage our Bahrainian colleagues just to ask more, to integrate more, and we are putting the policies now in Bahrain.
Yes.
We are doing the guidelines. So for Egypt, أنا معاكم. I'll be with you in Egypt for anything doing policies. But really, I have lots of heart.
Yes, I know.
I want to go Bahrainian right now.
I know it very well from long
Yes.
time.
Yes.
I understand it. But يعني احنا يبقى عندنا
Egypt, they have you go and Egypt with everything with Egypt, but I take me away from the problems in Egypt now.
إن شاء الله هتتحل بإذن الله.
You are in the right track. You are in the right track. But this series of lectures is mainly for Bahrain, and really what I see here that things are modifiable and we can.
Yes, thank you very much.
With the guidelines, but everything.
أرهقناك النهارده. شكرا جزيلا. وخلاص بكره نتقابل الصبح إن شاء الله.
إن شاء الله. يلا.
في السعودية. شكرا.
So, any more questions from our Bahrainian colleagues? No? And so next week, inshallah, Dr. Sami is going to have a very important presentation about the pre-invasive cervical cancer, cervical lesions, pre-invasive cervical lesions, how we detect, how we screen, and with tips and tricks. He has a very long experience in that with the colposcopy and what to do. So Dr. Sami, next Wednesday, 6 p.m. inshallah, we are waiting you. Inshallah. Thank you. Thank you and good night.
Okay.
Good night. Assalamu alaikum.